Thank you, Professor Parker, for outlining an approach that we can all take home. I would now like to introduce Associate Professor Marie Bismark. Associate Professor Marie Bismark is a public health physician and psychiatry registrar who leads the Law and Public Health Group at the University of Melbourne. Marie also serves as a non-executive director on the boards of a number of health sector companies, including Somerset Aged Care and GMHBA Health Insurance. Marie has previously served as a legal advisor to the Health and Disability Commissioner, been a solicitor with a leading New Zealand law firm, and completed a Harkness Fellowship at Harvard University. She has published widely on patient safety, health practitioner regulation, and suicide by health practitioners. Please join me in welcoming Professor Marie Bismark.
If you listen to my bio, my life sounds pretty good, doesn't it? But today I'm going to give you a little bit of a behind-the-scenes insight into what last year was like for me. Last year I was working in an overstretched mental health service. Is there any other kind? I was punched in the face by a patient after my boss said she couldn't smoke a cigarette. Thankfully, not as brutally as Patrick Stegman, who was killed in a similar incident. I packed up my house and resigned my job for a registrar position in New Zealand, only for circumstances to change and to have to unpack my house and unresign my job. A senior consultant, who I'd thought of as a mentor, turned out to be more predator than mentor, and my best friend's mum was diagnosed with metastatic cancer. So those are the things that you don't hear when you hear a speaker's bio. My long-standing anxiety disorder didn't respond well. I found myself waking at 4 a.m. with a mind full of worries. I had a special cubicle for crying in the bathroom at work and found it harder and harder to leave the house for anything other than my work or my children. My experience of deteriorating mental health while facing a concatenation of stressors was not unusual for a doctor. In general, doctors live much healthier lives than most, but as we've already heard this morning, we have high rates of mental illness and burnout. In 2016, working with suicide researcher Alison Milner, I contributed to the first nationwide study of doctors' deaths by suicide in Australia. We identified all deaths by suicide among employed adults over a 10-year period. These figures are likely to be underestimates due to the difficulty of identifying some deaths as having suicidal intent. We compared the rates for 4 occupational groups: doctors, nurses, other health professions, and other occupations. As you can see on this slide, we found that the rate of suicide among male doctors was just as worrying as the rate among men in other occupations. Among women, the rate of completed suicide was more than double the rate for women working in other occupations. At least part of the explanation for the higher rate of suicide among female doctors can be found when you look at the methods used. Women tend to attempt suicide by self-poisoning, which among the general population has a much lower lethality than the methods more commonly chosen by men, such as hanging. Unfortunately, when doctors choose self-poisoning, they have both knowledge and access to lethal means. Over half of the suicide deaths among doctors in our study were by self-poisoning, compared with only 1 in 10 among other occupations. When we looked across all 15 health professions, ranging from dentistry to physiotherapy, the suicide rate was 60% higher among those health professions with ready access to prescription medicine. So as members of this hurting, healing profession, how can we help? As the safety briefing on the plane reminded me this morning, in case of emergency, put on your own oxygen mask first. So let's start with kindness towards ourselves. I'm sure that I'm not the only one in this room who, as a junior doctor, responded to an urgent page to chart IV fluids or insert a catheter for a patient when it had been many, many hours since I last hydrated myself or emptied my own bladder. I'm seeing some nods of recognition around the room. Why is it so hard to take care of ourselves the same way that we would take care of someone who we're responsible for? As we all know, there's strong evidence that simple daily habits can improve our physical and mental health. My own personal checklist goes something like this. Have you filled your lungs with air and let it go again? Have you eaten something that grew in the ground or on a tree? Have you stretched like a cat? Have you made someone smile? Have you called your mum? Have you stepped outside? Have you said thank you for something beautiful in your day? Having filled our own cup, at least a little, we're in a better position to show empathic concern for others. My friend Kate Kenfield describes empathy as the state of having curiosity about and non-judgmental engagement with someone else's emotional world. The non-judgmental text from a friend that we heard about earlier. One of the ways that I cope is by baking. When I'm not sleeping well, it gives me something to do in the pre-dawn hours. It keeps my hands and my mind occupied, and my colleagues kind of love it. On one particularly hard day last year, after I shared a cake at morning tea, I came back to my desk, and there was a note from our social worker saying, "That cake was so good, I'm worried about your mental health." That is empathic observation, that this wonderful, wonderful woman had heard me make an offhand comment that I baked when I was stressed. And where other people saw chocolate cake, she saw a reason for concern. And in turn, her empathic concern made me feel safe to open up and seek support. We're so well conditioned to say that we're all fine when life is anything but fine, that getting beyond superficial talk can make some effort. If you're feeling concerned about a colleague, why don't you try saying, "How are you? Do you want to catch up over a cuppa? What do you wish you had more time for in your day? Is there something else you would like to talk about?" As doctors, we deal with pain and suffering every day, yet sometimes we still miss the warning signs among the people we work with most closely. Part of the reason is that we're high-functioning people who are used to smiling and showing up through adversity to get the job done. As Kim Jenkins, one of the wisest psychiatrists I know, says, by the time a doctor's mental health or substance use are impacting on their job, it's likely that every other part of their life is already suffering. There was a week last year when a change of medication caused me to experience intrusive suicidal ideation. I knew that it was a side effect and that it would pass, but my body was agitated and my mind was filled with images of my own death. I went to a team planning day the next day with some of Melbourne's leading psychiatrists who were either oblivious to my distress or chose not to comment on it. And that evening I sat with my GP and agreed to daily appointments and some sick leave to make sure that both I and my patients were safe. So what are the warning signs we should be looking out for in ourselves and among our colleagues? We've already heard some from Prof Parker's wonderful presentation. My colleague Matthew Spittle, a suicide researcher, recently conducted a meta-analysis of suicide screening tools. He had good news and bad news. The bad news is that the risk factors for suicide are so common and completed suicide so rare that risk screens have very low predictive value. The good news is that there is value in addressing the needs of people with any of these risk factors, if only to reduce suffering. When thinking about stressors, we shouldn't underestimate the impact of medico-legal claims and complaints. Some of you may have read the beautiful piece in MJA Insight by Kate Harding, whose husband Richard died by suicide. She writes, "A complaint, however minor, has deep and long-lasting ramifications for doctors. The vast majority of us are trying to do our best. We genuinely want to help our patients, do some good in this troubled world, go home to our families feeling that we made a difference." Having worked in health law for over 15 years, I see three critical challenges to reduce the harm caused by regulatory processes that are supposed to make healthcare safer. First, we need to humanise the complaints process. Make sure that those responsible for handling complaints are sensitive to the stress on patients and practitioners. Encourage one-on-one conversations rather than legalistic jargon, and reduce delays so that concerns can be resolved and lives can move on. Second, we need to bust some pervasive myths. Seeing your doctor for a mental health issue, as I did, does not trigger a mandatory report, except for the very rare situation where patients are at substantial risk of harm. I spent a full year analysing every mandatory report made to AHPRA with funding thanks to the RACP, and found that mandatory reports by treating practitioners are exceptionally rare, and they usually only occur where a doctor has dementia, psychosis or addiction and lacks insight or refuses to comply with treatment. So if you are worried about your own mental health, please do seek help. Third, I think we need to create a culture of learning where we support doctors with their health or competence concerns back into safe practice as early as possible. So many of the complaints to the medical board that I read could have been averted by early and supportive care and treatment. We're all human. We will and do mess up, and there should be a chance for us to return and to be given a second chance. As I regularly tell my children, there's an important difference between speaking up to get someone into trouble and speaking up to get someone out of trouble. Our analysis of 6 years of notifications to the medical board shows that patients are the most common source of complaints about treatment and access to care, but employers and colleagues and practitioners themselves are best placed to identify risks to mental health that may affect patient care. A disciplinary prosecution in 2015 brought home the risk that baby monsters flourish when we hide them in the dark. I love that saying, that baby monsters flourish when we hide them in the dark. A pharmacist had a drug addiction known to at least 2 other practitioners. When he dropped out of treatment for his addiction, they remained silent rather than taking action to ensure he was receiving appropriate care. The tribunal commented that in this case, the code of silence within the profession had acted to both the detriment of the public and to the practitioner himself. In addition to my work on doctors' health, I also research clinical governance and patient safety. Over and over again, I'm struck by the reality that many of the things that improve doctors' health improve staff engagement and patient outcomes too. Burned out doctors are more likely to make errors, to work less efficiently, to quit medicine. When doctors are more empathic, patients provide more accurate information and diagnoses become more accurate. Nothing exists in isolation. There are threads of light interwoven between the health of our profession, the health of our patients, and the health of our community. From the elderly patient with dementia to the highest earning cardiologist in the room, to the cleaner who pauses at the bed of a dying woman to offer a few words of comfort, we all benefit when we feel in control and able to make choices, recognised and appreciated, connected and included, fairly treated and respected, purposeful and engaged, rested and protected. The final element of kindness requires us to lift our gaze from the individual to the system we work within, to ask how can we create cultures within workplaces where harmony and well-being can thrive. My challenge to you today is to reflect on the causes of poor mental health within our profession and identify one difference that you can make in the world. To find that sweet spot where you can help to heal medicine, ask yourself 3 questions. What's a problem that bothers me? Is it something I could help to fix? Am I willing to fix it? Keep asking until the answer to all 3 questions is yes. You might choose recognition and send a thank you text to a colleague who made your job more joyful last week. You might choose fairness and work with the college to improve flexibility for trainees and physicians during their early parenting years. You might choose rest and push for proper sick leave for doctors. You might choose purpose and decide to look for a job in an organisation whose values are aligned with your own. You might choose community and reach out to a colleague for help in the knowledge that by making yourself vulnerable, you give them permission to one day ask you for help. Search until you find something that bothers you. that you could fix, that you would fix, and then fix it. That is enough for the day.